Hello and welcome to Healthcare IT Today, where we explore the latest healthcare technology trends and discover valuable insights in health IT. I'm Colin Hung, and joining me today is Dan Czech, Senior Insights Director for Patient Engagement with KLAS Research. Dan, welcome to the program.
It's nice to be with you today, Colin.
I'm excited because you came out with, or KLAS came out with recently, a new segment insights that was focused on patient communications. And I think the title of it was Patient Communications Landscape for 2022. And there was a lot of great stuff in this report, and I want to dive into it with you.
That sounds fun. I love to talk about this topic.
So first of all, right off the bat, I got to ask you this. So in this report, you actually divide what once was a single category of vendors and products into two separate categories. You now have patient communication solutions, and then something you call patient-driven care management solutions. Can you help us with that distinction? What's the difference between the two?
Yeah, so this decision to split the categories, actually one of the main purposes of this report was to find a way to take a data-driven approach to separating the vendors by the type of work that they do. We were hearing both from the vendors as well as the provider organizations that had shared their perspective with KLAS that it wasn't quite hitting the mark. We had used patient outreach, which was the former category name, as almost a landing space for any patient engagement solution that did some form of communication with patients, and quickly realized that vendor A and vendor X were very different in their approach to the market and the needs they were trying to meet. So in an effort to provide clarity to provider organizations and help compare as much as possible similar vendors, that was our decision to split these two categories. And it was really interesting. The way that we went about doing this was we asked every customer of these vendors that we spoke with, what were the different use cases you used this technology for? We had a list of about 17 capabilities, and we went through this list with every organization. And we had some gut feel for what we thought the vendors would look like. And it was appalling when I did the analysis and started to compare the different vendors. It just popped out of the page in my spreadsheet of these vendors are clearly this type, these vendors are clearly this type. And it was really easy. And then as I started to dig deeper in the analysis, it followed through of patient communication vendors typically saw one type of outcome, which was more administrative outcomes. And then patient-driven care management solutions typically saw clinical type outcomes like reduced readmissions or reduced length of stay. So the way we look at this, what we saw in the data, the primary differentiator between the two is patient communications are often flexible communication tools that at their core are appointment reminders, broadcast messaging type tools, but can be used to deliver different types of content, different types of messages to patients. Whereas a patient-driven care management solution is a communication tool, but it's really driven around a specific journey or pathway, a template, whatever you'd like to call it. But let's say, for example, a total knee replacement. Mm-hmm. An organization may use one of these solutions to engage the patient prior to the procedure to prepare them, make sure that they come in ready to go and able to get the best care, follows them through their inpatient stay all the way post surgery into recovery and patient reported outcomes. And it's a very specific and targeted communication path. So that's the main difference between the two.
I like one of the distinctions you made there. Although I know both sets of tools and vendors play in the opposite world, but predominantly what I heard was that the patient communication side, is really focused on administrative outcomes, right? Getting you back in, payments, those kinds of things. Whereas the patient-driven communication tools, what you're saying is it's a little bit more driven on the outcomes for that individual patient and helping them through that journey of whatever is happening with their procedure or with the disease that they have or a condition that they have and so forth.
That's right.
Awesome.
And it's interesting that many of these vendors on both sides they cross both. They show a small portion of clinical outcomes if you're a patient communications vendor, but you almost hear from every organization that you talk to that's a patient communications customer, reduced no-show rates. That's the industry standard for these types of tools. Everybody talks about reducing their no-show rates.
So I want to go back to something you said earlier, and it's kind of related to this no-show. I mean, that it is sort of the main use case, right? Is, appointment reminders or reminders of that you need to make an appointment, right? Based on where you are in your, how long you've not seen a doctor or seen your specialist. You came up with 17 use cases as part of in this report. Were these 17 the 17 that you knew going in that people were using it for, or did you sort of discover these as part of creating this report? Because there's a lot in here. There's like, wellness reminders, there's care gap reminders, patient surveys, payment reminders, pre-visit education. Like these were all some of the use cases that were in this report.
Yeah. So this list was actually driven by a couple of different, I guess, inputs. One was KLAS has held multiple summits over the past couple of years focused on patient engagement. And right before the pandemic hit, we held one late 2019. And our goal was to refine the list of what a patient engagement solution should offer. The summit prior to that came up with a list of 80 capabilities, not just communication capabilities, but broad patient engagement capabilities. And we targeted this group. This was a group of vendor executives, provider organization executives. There were even patients in the room, and we had surveyed patients as well. And so we worked through that meeting to focus the list of communication capabilities. So we'd use that as a starting point. We refined the list from what we had been hearing from provider organizations, as well as what vendors targeted both on their websites and as well as conversations that they shared with us. And 17 is still a lot of capabilities, but the specific types of communications are almost endless that organizations can use these tools for.
Yeah, I mean, these tools, companies like Clara, Well Health, Relation, Solution Reach, these are all companies that are highlighted in your report. They are truly flexible, right? They can send messages that are more than just appointment reminders. They can include links to education and other things as well. The vendors have gotten beyond the single use cases like they were when they first started years and years ago.
Yeah.
And I'm going to ask you about that actually. Like, did you run into situations where the providers have multiples of these solutions? Like they have more than one of these vendors that were in your report?
Yeah, we did. So it wasn't common, but we did. I would say it was more common that they had a patient communications and a patient-driven care management solution, because while they overlap a little bit, the use cases are pretty distinct. But there were several organizations that were using two different solutions. That they might be using one for their inpatient needs and one for their ambulatory needs, or they may have a specific department that was using one solution, that whether the vendor had gotten in through a department lead or whatever their entry point was, but they may have one isolated use case and then a more enterprise platform. But we do see both in this space and in broader patient engagement technology decisions that organizations are trying to get to as few vendors as possible. And you see that in the vendor development and both through acquisitions and development as well, where they are trying to increase the number of capabilities that they offer to an organization in an effort to gain that stronghold and really become an indispensable solution.
So today there's separate categories. I mean, do you see these vendors in both these spaces coming back together again down the road, or do you think they're really going to be separate and distinct for a long time, given that the use cases are so different?
I think that's something we'll have to keep an eye on over the next couple of years. I would anticipate from what we've seen in other patient engagement technologies that the organizations will continue to expand their functionalities and capabilities in this space. And I think organizations sometimes, though, provider organizations in particular, are a little hesitant when a vendor comes in and says, we can do it all, we can be your solution for everything. Sometimes that's a bad thing. You don't want a jack of all trades that's a master of none. So if they have a really targeted need for a specific type of communication, I wouldn't be surprised to see some of these organizations that meet that very specific need maintaining relevance.
Gotcha. Gotcha. Yeah, it makes sense because you're right. I mean, none of us want to. No, well, no provider I don't think wants to implement a monolith, right? I think they've learned some lessons there, and so but also they don't want best of breed where you have 19 vendors that do basically the same thing, right? I think somewhere
Right.
in the middle is the magic spot. So it will be
Yeah.
interesting to track this over the next few years.
I think the other thing organizations will be considering, they do today and will even more in the future, is how do these communication solutions augment what my EMR vendors are already doing? So it's a decision point today, and those that augment rather than compete with EMR and portal technology are going to be the ones that stay compelling in this industry.
Let's switch for a moment to talk about the patient-driven communications side. There, you highlighted some companies in the report, like GetWell, Twistle, Wolters Kluwer's. And one of the things I noticed when reading it is all three of these companies create their own content for those specific conditions or procedures that they're helping patients journey through. So it sounds like that today is a key differentiator. Is that what you found?
Yeah, because we saw from their customers' perspectives that while the content is there, it's not always created equal. It doesn't always apply to their specific desired care journey or pathway for the way they do business as an organization. So I think there will always be a need to customize the content that is provided. I do think that the basic content, as this market matures over the next handful of years, will get relatively standardized, and hate to use the word commodity, but it'll be consistent across the industry, and organizations will be able to leverage best practices from other organizations that have helped refine the content and start from a much better starting place.
So it sounds like, down the road, we want, the creation of the content may no longer be a huge differentiator, but the customization is definitely sounding like it's going to be a requirement that,
Yes.
for my hospital, my organization, I wanted my patients to journey this way. So I want extra content here, or I want my own content here, because that was, again, was highlighted in the report, where how easy or hard it was to customize that content was a big factor for a lot of the providers you spoke to.
Yeah. And it's interesting, there's a parallel to this on the patient communication side with appointment reminders. If you look back 3, 4, 5 years ago, many organizations were kind of choosing their own journey with how frequently do I communicate with my patients, and what does that cadence look like, and what do the messages look like. It's relatively standard in the industry today. We've done enough studies, what is the right frequency to reach out to your patients, what should those messages look like. And so that is no longer the differentiator that it used to be. I would anticipate the content on patient-driven care management to be similar if you look 2 or 3 years down the road.
Now, of course, whenever you come out with a report like this, and this is true of any KLAS report, not just this one, there are probably companies that are looking at this list and this report going, hey, how come we're not on there? And you forgot about so-and-so, and what about this vendor? What's the message to them? How can they get on these reports or into your radar?
Yeah, I would say, especially with patient engagement, we probably hear about a new company on a daily basis, if not more frequently than that. So we've actually, over the past few years, created some new entry points to being measured at KLAS, what we call them emerging technology reports or spotlight reports. A new up and coming vendor will talk to early customers and share with the industry what outcomes and successes early customers are seeing. So that's one entry point for an organization that wasn't measured in this report. If they have a significant customer base, we can go through the standard measurement process and going and talking to customers and including them in this category going forward. There are several on our radar that, just due to capacity constraints and other factors, we just couldn't get to for this research. I would say there's probably another few dozen communication solutions in the market today, if not more.
I can imagine that grid that you have is going to have a lot more logos on it the next iteration that you do this report for.
Yep.
Dan, final question, where can people go to download the report?
Yeah, you can go to KLASresearch.com and click on our report section of the website. You can also reach out to me at dan.czech@KLASresearch.com, and I'll get a copy of the report to you. We love doing these reports, and our mission at KLAS is to improve the delivery of healthcare in the world by bringing transparency into how well vendors deliver for their customers. So any healthcare organization that wants access to that and is using that to help make a smart purchasing decision, we want that in their hands.
Amazing. Dan, thank you so much for the information you shared today. It's been a pleasure having you on the program.
Likewise, this was a lot of fun, Colin. Thank you for inviting me.
Hey, if you enjoyed this interview as much as I did, we'd love for you to subscribe, rate, and give us a review on iTunes, YouTube, or wherever you're listening or watching this. Also, head on over to healthcareittoday.com, where you can find free resources, industry news, and insightful articles. You can also connect with us on Twitter using the hashtag HITSM. I'm Colin Hung. Thanks for being here.